Question 1. I10 centimeter coding guidelines and combination codes. A patient is diagnosed with both type 2 diabetes mellitus and diabetic chronic kidney disease CKD, stage 3. According to I10 centimeter coding conventions, how should this diagnosis be coded? A. 0.22 N.3 B. 0.9 N.3 C. 0.21 N.3 D. 0.29 N.3. Answer A. 0.22 N.3. Explanation. I10 centimeter has specific coding conventions for conditions that are commonly associated with each other. Diabetes mellitus with chronic kidney disease is classified as a combination code E.22, which inherently links diabetes and CKD, per I10 centimeter official guidelines for coding and reporting, Section I. A.15. A combination code should be used when a single code describes both the underlying condition and its associated manifestations. The secondary code N.3 represents CKD stage 3, E.22. Type 2 diabetes mellitus with diabetic chronic kidney disease correctly reflects the diabetic complication, E.9. Type 2 diabetes mellitus without complications is incorrect because it indicate the CKD, E.21. Type 2 diabetes mellitus with diabetic nephropathy is incorrect since nephropathy is not the same as CKD, E.29. Type 2 diabetes mellitus with other diabetic kidney complications is incorrect because CKD has a more specific code under 0.22. Thus, the best answer is the 0.22 N.3. Question 2. Compliance and regulatory guidelines. Scenario-based. Dr. Lewis, a family physician, refers his patients to a diagnostic imaging center that he partially owns. He does not inform the patients about his financial interest in the facility. The compliance officer discovers this and raises concerns about a potential violation of federal regulations. What legal issue is most relevant in this situation? A. The anti-kickback statute, Acts. B. The Stark Law. C. HIPAA privacy rule. D. The False Claims Act, FCA. Answer B. The Stark Law. Explanation. This scenario involves physician self-referral, which is governed by the Stark Law, 42 U.S.C. SS 1395, and the Stark Law prohibits physicians from referring Medicare or Medicaid patients to an entity with which they or their immediate family have financial interest unless an exception applies. The anti-kickback statute, Acts Option A, is also relevant but focuses on intentional payment for referral schemes, whereas Stark Law is strict liability statute that does not require intent. HIPAA privacy rule, Option C, governs information security and is unrelated to self-referrals. The False Claims Act, FCA, Option D, relates to fraudulent billing but is not the primary issue in self-referral cases. Because Dr. Lewis failed to disclose his financial relationship, his actions most likely violate Stark Law, making B, the Stark Law, the correct answer. Question 3. Claim submission and denials. A medical coder submits a claim for a colonoscopy procedure. However, the insurance payer denies the claim, citing the procedure to procedure PTP edit conflicts. What should be the next step to address this denial? A. Resubmit the claim with a different CPT code for a similar procedure. B. Apply a modifier if appropriate to indicate the procedures were separate and distinct. C. Bill the patient directly for the denied service since insurance denied it. D. Ignore the denial since insurance decisions cannot be appealed. Answer. B. Apply a modifier if appropriate to indicate the procedures were separate and distinct. Explanation. The National Correct Coding Initiative, NCA, prevents improper payment for procedures that should not be billed together unless specific conditions apply. When a procedure-to-procedure PTP edit conflict arises, coders should check if an appropriate modifier e.g. modifier 59 for distinct procedural services or for separate structure applies. Resubmitting with a different CPT code, Option A, is incorrect because it may lead to coding fraud. Billing the patient directly, Option C, is improper since insurance denial does not automatically shift financial responsibility to the patient. Ignoring the denial, Option D, is incorrect as appeals and corrections are an essential part of revenue cycle management. Thus B, applying a modifier if appropriate, best response. Question 4. Evaluation and management. M. Coding complexity. A 52-year-old patient with a history of uncontrolled hypertension and type 2 diabetes mellitus presents to the physician's office complaining of severe headaches and occasional dizziness. The physician conducts comprehensive history, detailed physical examination, and medical decision-making of moderate complexity. The provider spends a total of 45 minutes face-to-face with the including counseling about lifestyle changes and medication management. Which of the following codes is the most appropriate for this visit under 2021 M guidelines? A. 99214, B. 99204, C. 99215, D. 99205. Correct answer A. 99214. Explanation: the 2021 M coding guidelines emphasize the time spent with the patient or medical decision-making (MDM) as the key factors in selecting an office visit code. 99214 is a Level 4 established patient visit that requires moderate complexity medical decision-making or a total time of 3039 minutes, which includes face-to-face and non-face activities on the day of the encounter, since the visit included a comprehensive history, moderate MDM, and 45 minutes total time. This is the correct choice. 99204 is for new patients, but this patient is established. 99215 requires high complexity MDM or 4054 minutes. While the time is within range, the MDM was moderate, not high. 99205 is patient visit and is inappropriate for an established patient. Thus, 99214 is the most appropriate code based on time and Question for ATCS and durable medical equipment DME billing. A patient with chronic obstructive pulmonary disease (COT) requires supplemental oxygen therapy at home. The physician prescribes a portable oxygen concentrator, which will be rented monthly through Medicare. ATCS levodopa should be used for this service. A. B. At C. D. Answer A. Explanation: AECS levodopa are used for billing medical equipment, supplies, and services. The correct code selection depends on the type of EME durable medical equipment provided. Is the TCS levodopa for an oxygen concentrator, which is the correct choice for a portable oxygen concentrator rented on a monthly basis as an ambulance transport code, not relevant for oxygen equipment. J. A medication code for albuterol inhalation solution, not an oxygen concentrator. E is the code for a portable gaseous oxygen system, which is different from an oxygen concentrator. Thus, the best choice. Question 6. ICDEN PCS root operations in inpatient procedures. A patient undergoes a laparoscopic cholecystectomy due to gallbladder disease. Under ICDEN PCS, which root operation best describes this procedure? A. Excision, B. Resection, C. Extraction, D. Drainage. Answer B. Resection. Explanation: ICDEN PCS code requires understanding root operations, which define the objective of the procedure. Resection is the correct answer because it involves removing the entire gallbladder. Per ICDEN PCS guidelines, resection means cutting out or removing all of a body part. Excision refers to removing a portion of a body part, which does not apply here. Extraction is used when the procedure pulls or strips out a body part by force. DC. Drainage refers to removing fluids or gases from a body part, which is not the purpose of a cholecystectomy. Therefore, the correct answer is B. Resection. Question 7. HIPAA and patient privacy violations. A medical billing company accidentally emails a patient's full medical records to the wrong recipient, violating HIPAA privacy rules. What is the most appropriate course of action following this incident? A. The company should notify the patient and report the breach to the Department of Health and Human Service (HHS) if necessary. B. The company should delete the email and take no further action since it was an accident. C. The company should only inform the intended recipient and ask them to delete the email. D. The company should report the breach to local law enforcement instead of HHS. Answer A. The company should notify the patient and report the breach to the Department of Health and Human Service (HHS) if necessary. Explanation: under the HIPAA breach notification rule 45 OSS 164.400414, covered entities must notify affected individuals and potentially report the breach to 8HS if it involves protected health information. 5. Accidental disclosure still qualifies as HIPAA breach, meaning it must be reported based on the level of risk. If it involves over 500 individuals, the breach must be reported to 8HS within 60 days. Simply deleting the email, option B, does not eliminate liability. Informing only the intended recipient, option C, is insufficient since the patient is the affected party. Law enforcement is not the primary authority of D for HIPAA violations unless fraud is suspected. Thus, the correct answer is notify the patient and report the breach if necessary. Question 8. Medical billing and claim rejections. A patient receives a Medicare-covered colonoscopy screening. However, the claim is denied because the provider incorrectly coded it as a diagnostic colonoscopy instead of a preventive service. How should this error be corrected? A. Submit a corrected claim with the appropriate CPT code for a screening colonoscopy. B. Appeal the denial and argue that Medicare should still cover the diagnostic procedure. C. Bill the patient directly for the full cost of the procedure. D. Add modifier negative 22 increased procedural services to justify payment. Answer A. Submit a corrected claim with the appropriate CPT code for a screening colonoscopy. Explanation. Medicare covers screening colonoscopies under preventive services, but if coded incorrectly, it may result in a denial. The correct response is to submit a corrected claim with the right CPT code E. G 45378 for screening colonoscopy, G for screening in non-high-risk patients. Appealing the denial. B is unnecessary if the original coding was incorrect. Billing the patient, option C, is inappropriate since Medicare covers screening colonoscopies fully. Modifier negative 22, option D, is for unusually complex procedures, which is not applicable here. The best action is to submit a corrected claim. Question 9. NCCI DITs and medical necessity denials. A cardiologist performs a Doppler echocardiogram, 93,306, and an electrocardiogram, 93,000, on the same patient during a single visit. The insurance claim is denied due to NCI DITs. What is the best action to take? A. Apply modifier negative 59 to indicate separate procedures if appropriate. B. Resubmit the claim using a different echocardiogram code. C. Remove one procedure from the claim to avoid a denial. D. Bill the procedures on separate days to bypass the edits. Answer A. Apply modifier negative 59 to indicate separate procedures if appropriate. Explanation. The National Correct Coding Initiative (NCAP) bundles certain procedures together to prevent overbilling. However, if the services were medically necessary and separate, modifier negative 59 can be added to indicate a distinct procedural service. Resubmitting with a different code, option B, could be fraudulent. Removing a valid procedure, C, results in lost reimbursement. Billing on separate days, option D, is unethical if both services were performed together. Thus, the best response score applying modifier negative 59 if justified. Question 10. CPT coding for surgical procedures. A 65-year-old male with a history of severe carotid artery stenosis undergoes a carotid endarterectomy to remove plaque from the left carotid artery. The procedure is performed under general anesthesia. We CPT code correctly represents this procedure. A. 35301, B. 36223, C. 35471, D. 37215. Answer A. 35301. Explanation. Carotid endarterectomy is a surgical procedure to remove plaque from the carotid artery to restore normal blood flow. The correct CPT code is 35301. Endarterectomy, including patch graft, if performed. The carotid artery 36223 is an angiography procedure which does not involve an endarterectomy. 35471 represents translip balloon angioplasty, which is different from an open surgical endarterectomy. 37215 is for carotid artery stenting, not an endarterectomy. Thus, the correct code for carotid endarterectomy is 35301. Question 11. CMS Global Surgical Package. A surgeon performs a laparoscopic appendectomy CPT 44970 on a patient. 3 days later, the patient returns due to a post-operative infection. The surgeon performs an incision and drainage ID of the abscess at the surgical site in the office. Which of the following is the correct billing approach? A. Report the ID procedure separately with modifier negative 79. B. Report the ID procedure separately with modifier negative 58. C. Include the ID in the global surgical package and do not bill separately. D. Bill for an M service with modifier negative 24. Answer. C. Include the ID in the global surgical package and do not bill separately. Explanation. Medicare and other payers follow CMS Global Surgical Package rules, which include post-operative complications that do not require a return to the operating room are covered under the global package. The global period for CPT 44970 laparoscopic appendectomy is 90 days since the ID was performed. Office not an operating room, it is included in the global surgical fee. Modifier -58 is used for stage procedures, which does not apply here. Modifier -79 is for unrelated procedures, which this is not. Modifier -24 is for M services unrelated to the surgery, which is not the case. Thus, the ID is included in the global surgical package and should not be billed separately. Question 12. Place of service POS. Codes in medical billing. A dermatologist performs a Mohs micrographic surgery on a patient in an ambulatory surgical center. Ask the procedure is billed to Medicare. Which place of service POS code should be used? A11. Office B22. Outpatient hospital C24. Ambulatory surgical center D21. Inpatient hospital. Answer C24. Ambulatory Surgical Center. Explanation. The POS, place of service, code indicates where the service was performed. POS 20 equals Ambulatory Surgical Center. Ask which is the correct choice for procedures performed in an ASC. POS lay equals office, which does not apply since the surgery was performed in an ASC. POS 20 towards a patient hospital, which is different from an ASC. POS 20 equals inpatient hospital, which is incorrect. Patient was not admitted. Thus, the correct POS code for an ASC setting is 24. Question 13. Medical necessity and upcoding. A physician documents a Level 5 established patient visit CPT 99,215, but the actual medical decision-making MDM and time spent only support a Level 3 visit CPT 99,213. What should the coder do? A. Submit CPT 99215 since it was documented. B. Submit CPT 99213 since it reflects the level of service provided. C. UCPT 99214 to compromise between documentation and service provided. D. Bill both 99213 and 99215 for additional reimbursement. Answer. B. Submit CPT 99213 since that reflects the level of service provided. Explanation. Upcoding, billing a higher level than supported is fraudulent and violates CMS guidelines. CPT 99213 is the correct code based on the MDM and time spent. Choosing CPT 99214 option C arbitrarily is also incorrect as coding must match documentation exactly. Both CPT 99213 and 99215 option D is improper and will trigger an audit. The correct approach is B, billing CPT 99213 the appropriate level of service. Question 14. Modifier -25 in M services. A patient visits their primary care provider for a wellness visit CEG and also discusses new symptoms of chest pain. The provider performs a detailed history and exam related to the chest pain, leading to a referral for a cardiology consultation. How should the claim be coded? A. Bill Gioli. B. Bill Gigian 99214 with modifier -25. C. Bill Gian 99214 without a modifier. D. Bill 99214 only. Answer. B. Bill Gigian 99214 with modifier -25. Explanation. Modifier -25 allows billing for a separately identifiable M service on the same day as a preventive service. The preventive visit GG and problem-based visit 99,214 are distinct without modifier -25. The second service may be denied. Billing only GG or only 9214 would result in underpayment. Thus, the correct coding is GG plus 99214 with modifier -25. Question 15. Diagnosis coding for diabetes complications. A patient with type 2 diabetes presents with diabetic nephropathy. What is the correct 10 centimeter coding? A. 0.9. B. 0.21. C. 0.22. D. 0.65. Answer. C. 0.22. Explanation. E. 0.22 type 2 diabetes mellitus with diabetic nephropathy. E. 0.9 is for diabetes without complications, which is incorrect. The 0.21 is for diabetes with ketoacidosis, which is unrelated. The 0.65 is for diabetes with hypoglycemia, not nephropathy. Thus, the 0.22 is the correct diagnosis code for diabetic nephropathy. Question 16. Fraud, waste, and abufo reporting. A medical coder notices that their employer routinely bills for services not rendered. What should they do first? A. Report to the Office of Inspector General OIG. B. Discuss concerns with the employer first. C. Ignore it to avoid conflict. D. Modify the claims to match what was provided. Answer: B. Discuss concerns with the employer first. Explanation: always attempt internal resolution first before escalating to authorities. If the issue persists, report to OIG or CMS. Ignoring the fraud. Option C is unethical. Modifying claims. Option D could result in personal legal consequences. Thus, the correct step is B. Internal discussion first, then escalate if needed. Question 17. CPT coding for colonoscopy procedures. A 60-year-old patient undergoes a screening colonoscopy. During the procedure, the gastroenterologist finds and removes a single polyp using cold forceps. Or CPT code S should be reported: A. 45378, B. 45380, C. 45385, D. 45378 and 45380. Answer: B. 45380. Explanation: 45378 will screening colonoscopy, but since a polyp was removed, a more specific code is needed. 453A is coloscopy with biopsy, single or multiple, which applies to polyp removal by cold forceps. 4538 equals coloscopy with snare polypectomy, which does not apply since cold forceps were used. 45378. Port 5380 should not be billed together as the screening code gets replaced by the therapeutic code. Thus, the correct code is 45380. Question 18. IC 10 cm coding for hypertension and DAE. A patient is diagnosed with hypertensive chronic kidney disease CKD, stage 3. What is the correct IC 10 cm coding? A. N.9, B. N.3, C. N.9 and N.3, D. in N.3. Answer: E. N.9 and N.3. Explanation: Rona ointnini was hypertensive CKD without heart failure used when hypertension is causing EKD a point the EKD stage 3, which must also be coded separately. Yet essential hypertension is incorrect because hypertension and CKD together require a specific code. Thus, the correct coding is N.9 plus N.3. Question 19. Modify a negative 59 for distinct services. A surgeon performs a laparoscopic cholecystectomy CPT 47562 and also repairs an umbilical hernia CPT 49585 during the same session. How should this be coded? 84756 and 49585. B. 47562 only. C. 47562 and 49585 with modify negative 59. D. 49585 only. Answer: C. 47562 and 49585 with modifier negative 59. Explanation: modifier negative 59. Distinct procedural service is required when two procedures are performed on different sites during the same session. 475 SICA, laparoscopic cholecystectomy. 4958 equals repair of umbilical hernia. Without modifier negative 59, the second procedure might be as bundled, thus 47562 plus 49585. 59 is the correct coding. Question 20. Medical necessity and billing. A patient requests an annual physical exam and also complains of worsening asthma symptoms. The provider performs both a preventive visit CPT 99,396 and an evaluation of asthma CPT 99,214. How should this be billed? A. 99396 only, B. 99214 only, C. 99396 and 99214 with modifier negative 25, D. 99396 and 99214 without a modifier. Answer: C. 99396 and 99214 with modifier negative 25. Explanation: modifier negative 25 allows an M service to be billed separately from a preventive visit if it is significant and separately identifiable. Both services are medically necessary in this case. Thus, the correct coding is 99396 plus 9921425. Question 21. Global surgery period and unrelated procedures. A patient has a cataract extraction CPT 66984. 2 weeks later, they return for treatment of an unrelated skin lesion by the same surgeon. How should the lesion removal be coded? A. Report the lesion removal with modifier negative 79. B. Include the lesion removal in the global package. C. Bill for an M visit with modifier negative 24. D. Do not bill for the lesion removal. Answer A. Report the lesion removal with modifier -79. Explanation. Modifier -79, unrelated procedure by the same physician during the postoperative period, is used because the skin lesion is unrelated to the cataract surgery. Thus, the correct approach is to bill the lesion removal separately with modifier -79. Question 22. Evaluation and management. Levels. A physician spends 45 minutes face-to-face with a patient managing a complex condition including extensive medical decision-making. Which CPT code is most appropriate? A. 99212, B. 99213, C. 99214, D. 99215. Answer D. 99215. Explanation. 99215 equals I complexity M visit requiring at least 40 minutes of face-to-face time. 99212, 99214 are lower complexity, thus the correct M code is 99215. Question 23. Fraudulent billing practices. A clinic submits claims for physician consultations when the visits were actually conducted by an unlicensed medical assistant. Which of the following best describes this practice? A. Upcoding, B. Unbundling, C. Phantom billing, D. Balance billing. Answer C. Phantom billing. Explanation. Phantom billing refers to billing for services not performed or performed by an unqualified person. Thus, this scenario represents fraudulent phantom billing. Question 20 for NCI edits and bundled services. A provider performs a joint aspiration CPT 20,610 and an injection into the same joint CPT 20,600 during the same visit. How should this be coded? A. 20610 and 20600, B. 20610 only, C. 20610 and 20600 with modifier -59, D. 20600 only. Answer B. 20610 only. Explanation. 20610 includes both aspiration and injection when performed in the same joint. 20600 is separately billable only if done on a different site, which is not the case here, thus only 20610 should be billed. Question 20 of ATCS level omentooding. A patient is prescribed a standard walker for mobility support. ATCS level omentood should be reported A, B, C, D. Answer B. Explanation. Z will anded walker adjustable or fixed height. Other options refer to different mobility aids, thus C is the correct code. Question 26. Incident to billing rules. A nurse practitioner NP provides a follow-up visit for a Medicare patient under a physician's care plan. The physician is not in the office at the time. How should this be billed? A. Under the NP's NPI at 85% of the physician's fee schedule. B. Under the physician's NPI as incident to. C. At full physician rates under the NP's NPI. D. The visit cannot be billed. Answer A. Under the NP's NPI at 85% of the physician's fee schedule. Explanation. Incident to billing requires the physician to be physically present in the office. Since the physician was not present, the service must be billed under the NP's NPI at 85% of the standard rate. Thus, the correct approach is billing under the NP's NPI at 85% reimbursement. Question 27 CPT coding for bilateral procedures. A surgeon performs a bilateral carpal tunnel release during the same operative session using an open approach. How should this be coded correctly? A. 6472150, B. 64721 64721, C. 64,720 NRT and 64,721 Lieutenant, D. 64721. Answer A. 6472150. Explanation. 6472 in equal on and carpal tunnel release per hand. Modifier -50. Bilateral procedure is required when the procedure is performed on both sides during the same session. Billing 64721 twice without a modifier may lead to claim rejection or reduced payment. Using RT and LT is acceptable but may not be the preferred form, depending on the payer. Thus, 6472150 is the most appropriate coding choice. Question 28. I-10 centimeter coding for diabetes with complications. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy and hypertension, which I-10 centimeter code should be assigned A. 0.9 N.9, B. 0.20 N.9 N.1, C. 0.22 N.9 N.9, D. 0.9 N.1. Answer C. Point 22.9 and point 9. Explanation. Point 20 tools type 2 diabetes mellitus with diabetic chronic kidney disease CKD. Point niwals hypertense CKD without heart failure. Endpoint niwals unspecified EKD, which must be coded alongside hypertension and diabetes. Thus, the correct coding is E. Point 22.9 and endpoint 9. Question 29. Modifiers for assistant surgeons. A primary surgeon performs a total hip arthroplasty CPT 27,130 with assistance from a qualified surgical assistant. Which modifier should be added to the assistant surgeon's claim? A. Negative 51, B. Negative 80, C. Negative 59, D. Lieutenant. Answer B. Negative 80. Explanation. Modifier negative 80. Assistant surgeon is used when a licensed assistant surgeon actively participates in a procedure. Modifier negative 51 is for multiple procedures, not assistants. Modifier negative 59 is for distinct services, not surgical assistants. Modifier LT is for laterality and not applicable in this context. Thus, the correct code is 27138080 for the assistant surgeon. Question 30. Global period rules for M visits. A patient returns to the clinic 10 days after surgery for an evaluation of a new unrelated condition. The procedure performed ham, a 90-day global period. How should the M visit be billed? A. Included in the global surgical package. B. Bill the M visit with modifier negative 24. C. Bill the M visit with modifier negative 25. D. The visit should not be billed. Answer B. Bill the M visit with modifier negative 24. Explanation. Modifier negative 24 unrelated M service during the postoperative period allows billing for a new unrelated condition within the global period. Modifier negative 25 applies to same-day procedures, not global period exceptions. If the condition were related to the surgery, the visit would be included in the global package and not separately billable. Thus, the correct billing approach is M visit plus modifier negative 24.